Cuba is a beautiful island stretching from the west to the east and populated with 11 million people. Villa Clara province in central Cuba, with a population of its own of 880,000, is blessed with a rolling countryside dotted with palm trees and agricultural lands. In the northwest are rugged hills populated by rugged mountain farmers. In spite of all this beauty, the province is stalked by a killer of women, a killer that comes in the form of breast cancer. 40,000 women of this province will die from breast cancer with current methods of symptomatic diagnosis. Adequate, easily accessible breast cancer screening can reduce this number by 90%. In its earliest stages, breast cancer is 95% curable with simple and readily available surgeries. In Cuba, women who develop breast cancer are often still raising their own children and grandchildren. This means that saving a woman's life may be saving a whole family from the motherlessness and poverty. In 2008, Medical Equipment Modernization Opportunity, MEMO for short, was approached by the Cuban Ministry of Health for help in fighting cancer in Cuba. Breast cancer, being the second most common cause of cancer death amongst Cuban women, was decided upon as the best place to begin. Breast cancer has an effective screening method using mammography and an effective cure using surgical intervention. In 2009, MEMO introduced and provided 2 breast screening clinics as a pilot project in the municipality of Placetas in Villa Clara province. One of these was a mobile clinic which travels to where the women live, making access much easier in this transportation-challenged country. MEMO's Cuban doctor, Dr. Aurora Riera, meets weekly with a breast cancer surgeon, the case pathologist, and a community nurse. They discuss the appropriate follow-up and treatment of women with early breast cancer as detected by their mammograms. This pilot project has been immensely successful, with dozens of women's lives being saved every year. MEMO has now embarked on an initiative to provide breast screening for the at-risk women in the 45 to 70-year age group in the province. Local Canadian volunteers will build mobile clinics equipped with modern mammography machines to be shipped to Cuba. MEMO will provide film developing chemicals, and film processing equipment to support the breast screening program. These additional mobile clinics will also be able to bring modern breast screening to the women where they live. Each mobile clinic can provide screening required by 16,000 women during their lifetime. Of further interest to you may be the cost of materials to build a mobile clinic, equip it with a modern mammography machine, and ship it to Cuba. The cost is approximately $20,000, and we are going to ask for your kind help with this. MEMO will also provide, through your generous donations, $10,000 worth of film and chemicals each year, with the resulting saving of up to 80 women's lives per year per clinic. Again, we ask for your generous and ongoing help with this. The Cuban Ministry of Health pays for all clinic staff and necessary logistical support for these clinics. As Canadian women, we are blessed with universally available and extremely well-funded breast screening programs. This initiative is an opportunity to express thankfulness by extending this blessing to our sisters in Cuba by donating to this proven, effective, and efficient initiative that will save women from horrible deaths. MEMO has no paid staff, so all gifts go entirely to fund the work of saving women's lives from breast cancer in Cuba. MEMO receives no government or corporate funding. MEMO is extremely efficient in accomplishing its tasks, so your donation goes for the purpose that it was given. These lovely Cuban women say thank you for your donation.